Several things to go over. First, the legal aspect of it. I noticed that Mr. Pallone mentioned that initially CBO estimated this would return $8 billion to the Treasury, and then glossed over the fact that now it's not going to return money to the Treasury, but rather it will be, quote, budget neutral, except as subject to appropriations. We don't know from whence they come. That is a far cry from being $8 billion to the government. And CBO, in their writings, I will note, said that the reason that they initially called it $8 billion because, Dr. Holdley, as you mentioned, in the Medicare Part D, there were payments back. But as it turns out, not only is it, I guess, now not going to be money back to the Treasury, but I'm told that before Mr. Issa's committee, subcommittee, or committee, it is now estimated that insurers are going to request over $1 billion more than they anticipate paying into the program. So far from returning $8 billion back, now they're going to require $1 billion more, and it is not clear where that money comes from. And as regards the memo, which supposedly HHS justifies with, it's interesting. They say that they're going to call this a fee, but in the President's budget, he doesn't call this a fee. Additionally, it's also of interest that never in the legislation is this called a fee, but now it's being called a fee. And a fee which goes into a revolving fund which is not being set up. So there is no subject of a revolving fund in the legislation, nor is there a comment of a fee, but now we're being told that it is a fee going into a revolving fund that heretofore did not exist, but has been manufactured through a legal opinion of HHS. Now, if the other side of the aisle is quite willing to do away with Congress's prerogative both to appropriate and to designate what shall be a revolving fund, that shall be up to the other side of the aisle to do away with prerogative. I suppose that comes from being loyal to one's president. Shame, shame. However, I say I will be loyal to the Constitution and support the Lance Cassidy bill, which requires an appropriation if this is to be the case, and requires that there be a specific statutory authority for a revolving fund, which the ACA specifically does not include. Now, just with that kind of setting the record straight, if you will, let me just now conclude with another statement, if you will. And again, going to the bill I'm sponsoring, Mr. Vogler. Did I pronounce that correctly, Vogler? I'm sorry. Vogler. I'm sorry. Dr. V. I'm sorry, Dr. V. It's interesting. The President and my congressional colleagues promised many times over the debate of the health care law that if you like your health plan, you can keep your health plan. This last year, 93,000 Louisianians in the individual markets lost the plan they had specifically because of Obamacare. Clearly, the President's promise was, to put it euphemistically, inaccurate. Now, in order to provide relief to the individuals losing their health coverage, the House passed Keep Your Health Plan Act, allowing plans available on the individual market before Obamacare to continue to be offered. The House must now act to provide the same relief to businesses and employees. Now, by passing my bill, the Employee Health Care Protection Act, which would allow the millions of workers in the group market to keep the health plan they like. I thank the committee for conducting this plan. Again, I thank Mr. Lance, my colleague, for working with me to introduce the Lance Cassidy Risk Corridor Bill. While it is important to allow risk mitigation mechanisms for companies in the private market, it is important that we ask the administration to follow the Constitution. The administration has decided to once more ignore the law as written by Congress and make payments to insurance companies without congressional approval. The Lance Cassidy bill ensures the Risk Corridor program does not become a vehicle for ignoring the Constitution by the administration. With that, I thank my colleague and I yield back.